So I'm curious, what was everyone's experience with your doctor like?
My doctor was great. Naturally, I had a lot of questions about Kybella since it is the first treatment of its kind. My doctor did tell me some interesting things, like that in order to administer it, each doctor has to be specially trained.
Yeah, I was surprised to learn how tailored treatment with Kybella can be. It's not a one-size-fits-all treatment. No two chins are alike, so why should it be?
Exactly. And not everyone will need the same number of treatments because not everyone's fat is distributed the same way.
What did everyone think about the whole injection thing? My doctor did a good job walking me through the injection process. And while I had some discomfort, icing the area helped.
For me, injections were a better choice than surgery.
Without a doubt. My doctor gave me a heads up prior to my first treatment. He told me Kybella can cause swelling, pain, or numbness in the injection area under the chin. But he told me if I did experience those effects, they would go away.
When did your double chin start to bother you?
It's something that I've been self-conscious about for a long time. My parents have fullness under their chins too, despite being in good shape. They passed it along to me. I've lost about 20 pounds over the last couple years, but I could never seem to do anything about my double chin. So Kybella was the right choice for me.
So how many treatments did you end up having?
I netted out with 6, and for me, each treatment was a bit easier than the last because I knew what to expect. I experienced some numbness, swelling, and pain under my chin after the first treatment. The numbness I really noticed while shaving since I couldn't feel the skin underneath.
Now, I'm sure you feel different, right?
Oh, for sure. It's funny, I was putting on my suit recently, and I used to dread buttoning the top button and tightening my tie because it was unflattering with my double chin. But now, I don't even think about it. I'm satisfied with the results. I'm all about spreading the word about Kybella. If you're bothered by fullness under your chin, what are you waiting for? Ask your doctor about it.
Approved use and important safety information about Kybella. Kybella is a prescription medicine used in adults to improve the appearance and profile of moderate to severe fat below the chin, submental fat, also called double chin. It is not known if Kybella is safe and effective for use outside of the submental area or in children less than 18 years of age. You should not receive Kybella if you have an infection in the treatment area. Before receiving Kybella, tell your healthcare provider about all of your medical conditions, including if you have had or plan to have surgery on your face, neck, or chin, have had cosmetic treatments on your face, neck, or chin, have had or have medical conditions in or near the neck area, have had or have trouble swallowing, have bleeding problems, are pregnant or plan to become pregnant, it is not known if Kybella will harm your unborn baby, are breastfeeding or plan to breastfeed, it is not known if Kybella passes into your breast milk. Talk to your healthcare provider about the best way to feed your baby if you receive Kybella. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Especially tell your healthcare provider if you take a medicine that prevents the clotting of your blood, antiplatelet or anticoagulant medicine. Kybella can cause serious side effects, including nerve injury in the jaw, which can cause an uneven smile or facial muscle weakness or trouble swallowing. The most common side effects of Kybella include swelling, bruising, pain, numbness, redness, and areas of hardness in the treatment area. These are not all of the possible side effects of Kybella. Call your healthcare provider for medical advice about side effects. Please see full prescribing information on mykybella.com.